Day 7 of learning exercise therapy. A therapist examines a patient 2 days status post THR using a posterolateral approach. The patient is in bed with a sling pulley system. Which exercise would be inappropriate for the patient, assuming an uncomplicated post-operative course? Answer: active assistive abduction and adduction with the thigh supported in the sling. A 25-year-old male is diagnosed with a first degree acromioclavicular sprain. The injury occurred 2 days ago after being checked into the boards while playing hockey. Which of the following would you not expect to be true during the initial examination? Answer: increased elevation of the clavicular end of the acromion. Patella tracking dysfunction is a common problem in orthopedics. Dynamic factors for patella tracking dysfunction include a shallow trochlear groove. A therapist instructs a patient in residual limb wrapping. Which bandage will be the most appropriate to utilize for a patient with a transfemoral amputation? Answer: a 6-inch bandage. A patient with an amputation must be competent with residual limb care. The most objective long-term goal for bandaging will be the patient will perform proper bandaging of the residual limb 100% of the time. A therapist provides preoperative training for a patient scheduled for thoracic surgery. Which activity would be most appropriate to deep vein thrombosis post-surgery? Answer: ankle pumps. A patient rehabilitating from cardiac surgery is monitored using an arterial line. The primary purpose of an arterial line is to measure the blood pressure. A therapist alerts a nurse to skin breakdown on a patient's right heel. Which position would leave the patient most susceptible to additional tissue damage? Answer: supine. A therapist reminds a patient of post-operative contraindications following hip replacement surgery. Which statement will not be considered good advice? Answer: when turning, pivot to the affected side.